Welcome back to our channel. New coronavirus spreads across Africa. During the past month, a novel coronavirus has spread rapidly around the globe. Now, the World Health Organization, WHO, has categorized the outbreak as a global health emergency. The coronavirus, named COVID-19, emerged in Wuhan, China, in December 2019. It is thought to be a cousin of SARS and MERS. China. The latest coronavirus outbreak has caused an explosion of infections in China, raising fears that a new variant of the virus could spread around the world. The strain, named COVID-19, first appeared in December in the central Chinese city of Wuhan, but scientists say it may have been spreading elsewhere before that. In a bid to control the disease, the government has quarantined millions of people in Wuhan and other cities by shutting down travel within and to those areas. But experts warn the massive efforts are unlikely to work, as COVID-19 seems to be able to easily spread outside of lockdown areas. The World Health Organization on Thursday declared the outbreak a global emergency, an acknowledgement that the disease poses a risk beyond its origin in China. In the wake of the declaration, some countries have shut down their borders or restricted travel to China. Europe. The new Omicron coronavirus variant, first detected in South Africa, has risen to a very high risk of spreading across Europe, the European Union's health agency said Friday. It added that the strain could potentially co-circulate with seasonal flu this winter. As a result, the region's public health experts are urging people to get vaccinated against both the flu and COVID-19. The WHO and ECDC say this will protect them against the virus, which can cause serious illness and death. But the new wave of infections has come ahead of similar rises in other regions, meaning it's unclear whether Europe is experiencing a normal uptick or if it's the start of a new pandemic. The WHO and ECDC caution that rapid assessment of new variants is key to assessing their transmissibility, evasion of pre-existing immunity, or changing clinical properties. That's why they praised European countries that have maintained strong surveillance. United States. On Friday, President Donald Trump called the global outbreak of COVID-19 a national emergency. This gives him broad authority to enact a range of policy measures and access to up to $50 billion in federal funds. The new coronavirus spreads quickly around the world, affecting people in countries with poor healthcare systems and causing a wide variety of symptoms. It can cause upper respiratory tract infections, sinuses, nose, and throat, or lower respiratory tract infections, lungs. A CDC report released Monday says a total of more than 16,000 cases have been reported in 75 countries so far this year. Africa has seen the most cases, with a rate of 1 in every 50 children infected. On Saturday, WHO Director General Tedros Adhanom Ghebreyesus overruled a panel of advisors and declared monkeypox a public health emergency of international concern, the agency's highest alert level. The decision marks the second time in 2 years that the WHO has taken a risky step by declaring a global health emergency. Africa. As the new coronavirus spreads across Africa, many of the same fears have arisen as in other parts of the world. This time, however, the pandemic is causing fewer deaths in sub-Saharan Africa than previously expected. There are a variety of theories for this, but one is that because Africa's population is so young, with a median age of 19 years, many people don't show up in the hospital with respiratory distress, so their deaths simply aren't counted. And the continent's climate is also relatively warm, which may help explain why the Delta variant ravaged India but didn't cause similar devastation here. While COVID-19 isn't as deadly in sub-Saharan Africa as it was elsewhere, it remains a risk, and African countries need to take aggressive measures to combat it. This includes investing in a range of public health and social interventions that will help vulnerable populations avoid the consequences of this disease. Specifically, governmental financial support for vulnerable communities can minimize the effects of poverty on their health. Thank you for joining us today on this journey to uncover of the coronavirus spreads across Africa. If you have any personal experiences or thoughts on this topic, please share them in the comments below. Don't forget to like, subscribe, and hit the notification bell to stay updated on our latest videos. Welcome back to our channel.